Hi. This is the teaching setup that we use to teach the users. I have a doll to demonstrate CPR or first aid training, and I have a test kit that they can use to simulate administer antidotes against opioids. We have a very simple slideshow, and the first slide is, it says in Danish of course, have you ever experienced an overdose? And then we talk about the overdoses that they have experienced on bodies or on themselves, and what they did and how the overdosed person looked like. After that we use some statistics, and it says more people die from an overdose than die in traffic in Denmark. And then we talk about that. Next slide is how do you take care of yourself when you do drugs. And we talk about using clean tools. We talk about having a system that one person observes the other so that you don't do drugs alone. And we talk about if you recently have been off drugs, when you start again you should take a lot less than you're used to. Then we have a picture of needles, and as you can maybe see, the first picture is of a needle that's never been used. Next picture used one time, and then after 6 uses. And this is just to demonstrate the importance of using clean and unused tools. Next slide, we come to opioids, because it's our main focus, and that's because this is what the antidote works against, and this is a safe antidote to use. Also, it's the most common drugs involved in overdoses. So we talk about the different kinds of opioids on the Danish black market. It's heroin, morphine, methadone, codeine, and fentanyl, and so on, all opioid derivatives. More about opioids, how do they work, and how does a person look when they've done an overdose on morphine. And we talk about that they could become comatose and don't breathe, maybe not at all, and that their lips and nails become blue. This says antidote, and it's called naloxone or Narcantia, it's the same. It says it only works against the opioids, and it works relatively quickly, after about 30 seconds to 1 minute. And we stress very powerfully that the antidote works for a lot less time than the actual drugs. This means that This means that when you administer an antidote, it's important to keep observing people, because you can have a re-overdose from the same drugs, even after you have administered the antidote. This is more the same. Antidote naloxone, you can die from an overdose hours later, even though you have already given antidote. And we try to stress this as much as possible. This is about what the law says. In Denmark we have a term called lægens medhjælp, or doctor's aid, where any doctor can appoint anybody to be an aide of a doctor and do work that you have to be a doctor to accomplish a medical doctor. And we tell them about the course. First thing, this is basic first aid or CPR. Always call for help and remember your own safety. This is now the end of the slideshow as is, and we go to the poster with the user and stand up. And this is our guidelines for administering first aid or CPR. And it says here signs of an overdose, no or weak breathing, blue lips and nails, and no reaction, and this means unconscious. That's what it means. Call for help. After that, make sure that airways are free, and you do this by bending backwards the head and opening the mouth. Listen and feel for breathing, like the picture shows, for a maximum of 10 seconds, and observe if the chest moves. If there's no response and no breathing, call 112, which is the Danish emergency number. Because if a person is unconscious and does not breathe normally, it translates to a heart stop. And it just says go further to step 4 and 5. If there is normal breathing, go to step 6. This is just how to administer CPR. 30 pressures on the chest, and 2 to breathe close.
Yeah.
And it says repeat this until the person wakes up and breathes normally or help arrives. That means emergency services. The antidote is step 5, and that is to say administering antidote may not ever interfere with the CPR or first aid. And this is quite important. It says help each other and use the antidote in the nostrils if it doesn't delay first aid or CPR. When the person wakes up, lie the person on the side and make sure the airways are free. And again it says administer antidote if there's any signs of an overdose, and stay with the person until the ambulance arrives. This is just how to administer the antidote, how you use it, and it's put the syringe on and suck up the antidote, take off the syringe, put on the nostril dispenser, and now it's ready. Put it up the nostril and administer. And that's it, and that's just the contents of the set that we give out. And this poster is also in the set. When we have explained this, I will demonstrate how to administer CPR, and then we'll simulate with the user coming in, and I'll explain a scenario where they find an unconscious friend who they know have just done drugs. We practice, and I make sure they know how to do proper CPR, and we practice how to administer the antidote. And again, we stress that you can't do first aid only one person. You have to be at least 2 persons. And we stress again that that administering the antidote may never ever hinder basic first aid. When we've made sure that they know how to do this, we go through the set. And this, what I have here, is just a test set, but it's the same as the real one. 2 vials of antidote and the tools to administer. You put on the syringe, open the antidote vials and suck it up, take off syringe, put on the nostril, administer, and you now have 2 milliliters of antidote, and you administer through the nose. The 2 other things that are in the kit are the instructions for first aid in Danish, with the front side exactly like the poster, and the back side is an instruction on how to administer the antidote. And we give them this. And the last thing, because in the scenario we use, it's an overdose, and a lot of person who has an overdose vomit up through their mouth, and it can be testing for someone to administer mouth to mouth with some with vomit in the mouth. So we have this bag where you can administer artificial breaths through the mouth through this. And this is all good. This is all certified for use by the Danish Council for CPR. And that's it. And if the users have any questions during this course, we try to answer them as best we can, and we use a Danish site for professionals for any questions about drugs. And the users already knows this page or most of them. And that's it. It takes 20 to 25 minutes if there's only one user being taught. If there's more than one, it's 30-35 minutes. And when the course is completed, we give them a certificate to certify that they know how to administer first aid, and we give them the legal documents that certifies that they are qualified to be a medical doctor's helper, so they can show at all times that they have the right to carry and use this antidote, which is a prescription in Denmark.
And how do they get a new doses
if they use their dose, they are told to come back here, and they can always get one free.
And how many times a week or a year you do this course?
We do this course every Thursday afternoon for 2.5 hours, and we are sitting in a health service house where there's a room for injecting drugs right beside us, and this place is a place where a lot of drug users gather in Copenhagen. So we try to catch them when the timing is right and they're not too much under the influence of alcohol or drugs.
Yes.